Next up, we have a little bit of information on DPI grants coming from the state of Wisconsin. And here to talk about that is Chris Crowe. Chris is the Principal Director of the North Star Academy in Barron, as well as a member of the Task Force Board of Directors. We're really fortunate to have him involved with our organization, keeping an eye out for these types of opportunities that are coming for the task force and for schools in Polk County. Sir?
Thanks, Tom. Yeah, so I think part of my goal today is to talk about needs and how we can start to fill some of those needs, because sometimes I think that's where crisis services, you know, as an educator who works that process, sometimes we get to the end of that and we're still hoping to have an intervention for the students that we work with day in and day out. So part of this process is just looking at where some of that funding might come from, and then I know Lisa's going to talk about a new program that we have here to just start laying the groundwork for some of the mental health work that we can do. Because believe it or not, the state budget this year did have, I would say, substantial dollars in it related to school-based mental health. And so I just want to cover some of those programs pretty quickly here, because some of them are still in progress. Please interrupt and ask questions. I spend a lot of time day in and day out with this stuff. And so if I'm going too fast or something is not making sense, please snag me and catch me before I move on too far. So 3 of the areas kind of highlight in the state budget where there's dollars related to school-based mental health is that there's $3 million this year allocated to expand social workers in schools. That's moving through a very bureaucratic rule-making process at DPI right now. Today is the last day for public comment on the rules related to that. I'll talk a little bit more about that one. There is one of the big things that we worked hard to get included is a Medicaid consultation code, so that providers who are working with school-aged youth can work with the school in a collaborative manner and receive reimbursement from Medicaid for that work. It's something that has not existed here before, and so we're excited to get that up and running. And there's a new $3.25 million DPI grant specifically focused on expanding school-based mental health services. And so I'm just going to cover each of those in a little bit more detail. The social worker program in schools, I spent a long time yesterday communicating with the person at DPI who's trying to get this up and running. The funding is actually for this year. But because the state budget was passed so late, there's still a lot of information that's not known. What we know is that it's going to be categorical aid. It's going to be driven through Fund 10, which would make sense depending on where you're at in your school, understanding where those expenditures have to come from. And they're going to reimburse schools for contract or direct hiring of social workers. All right, so those funds are for contracting or hiring directly. Aid payments for 18-19. Right, so there's aid payments coming into the next school year would be based on the increased expenditure for social work services in 16-17 to 17-18. So if you increase the amount of money you're spending on social work contracts or hiring social workers this year, you'd be able to receive funding for that likely in June at the end of this year. That all sounds great. Anybody here know a school social worker? Licensed DPI school social worker? Right. Josh in Rice Lake is the only licensed school social worker that I've ever met in this part of the state. They don't exist here. So one of the big unknowns, which they weren't able to answer yesterday, is, well, what are we talking about for licensure? Because honestly, if we're talking about school social worker DPI licensed individuals, I probably wouldn't have bothered with a slide, because you can't find them, because it's a very hard certification program. It's a hard licensing program, and there's only a couple of colleges that Wisconsin will let work for that. The big hope is that we'd be able to use state licensed social workers, bachelor level social workers from around the state, which is more readily available, although still not, there aren't a ton of social workers looking for work either around here. But that's one of the things that they're working out through the scope statement, and then they will put into rule for this funding. That should happen in the next couple of weeks. So we will know. In a perfect world, we will be able to contract with, as Unity does now, contract with the county for social workers and receive reimbursement for up to 50% of those funds. Or we can contract directly, or we can hire anyone who's a licensed social worker to come work in our schools to do that outreach work that's so necessary to provide a new level of intervention and support for students. Reimbursement amount isn't known yet either. The initial language looked at 50% reimbursement, so it'll cover the increase in expenditures up to 50% of the cost of those. How many districts in here have social workers other than Unity? Are there any? Yeah, so all of those would be considered new expenses for you then. So that's the social work provision. Again, the 27th is when they're hoping to have some of the rules laid out for that. And all I can say is they know at DPI that school social workers, DPI licensed school social workers are not readily available. And so I'm hoping that they take that to heart when they create rules around the social work expansion. And in an ideal world, an arrangement where districts could receive reimbursement for that sort of arrangement would be beneficial, because I think you could talk to Rachel and the Unity folks about the value that brings to the district and the level of intervention and support they can provide to students. So in my mind, if that's an outcome where we can expand a role similar to yours, Rachel, in schools, that would be something that we would, I think we'd be able to celebrate as a work for and on behalf of kids to provide some services to them. So. All right, Medicaid consultation. I won't go through this too much. I just know it's something that we've been working for 3 years at the state level to try and get included, because one of the things that happens, whether you're running a CST or whether you're in an IP or whether you're in a Tier 2 behavioral intervention meeting with parents and students, is if they're receiving services from a provider, right, the provider can't be reimbursed in order to come to those meetings, in order to provide insight when the family has the release and they want the provider there. There's no funding in order to bring providers to the table. The Medicaid reimbursement is going to allow that to happen. And so a provider who is invited to an IEP meeting would be able to attend that IEP meeting and submit reimbursement to Medicaid under the codes to participate in that under a consultation form. If there are barriers to success in the school environment and treatment goals, which should be aligned, right, in order to best meet student needs, the provider will be able to meet with the school officials in order to provide some of the insight when all of the releases are in place, and receive funding to do that through Medicaid, receive the reimbursement for services. So the consultation code it is a really important piece to the puzzle. Again, we don't know what it looks like yet. We have the legislative language that we put together for it, but then how that gets interpreted at DHS and Medicaid is still always up in the air. And so we're working really closely to try and make sure that that's not the Minnesota model. Minnesota has the same thing, but it never gets used because it's so intensive of needs. So we're really hoping for a baseline that lets providers consult with schools around the service needs of school-age children. So that's up to age 21. This information is all in the packet, and so I'm not going to necessarily go through it in any great detail. Something that we would be sharing out with you, especially to our providers though. But again, the schools would want to then start accessing those providers if there's funding available for it. It just breaks down some of those barriers to having everybody at the table to better understand how to meet the needs of an individual. Any questions on the Medicaid piece? Funding. So there's $250,000 associated with it. The governor line itemed some of the details related to that. And so Medicaid is going to have to create the rules in order to move that forward. And we just don't have a good timeline in regards to that, unfortunately. They did not want to meet last week to start having those discussions because there's too many other things that they're moving through the pipeline right now. But they are anxious to get it in place because of block granting conversations. They need to be expensing those dollars now in order to have them count if we move to a block grant system. So there is some motivation to get those things in place now.
Is there a DHS Medicaid person appointed to that process?
Yes, but I'd have to pull her name off of email. Yep. Yeah. Yeah, private insurance is all going to depend on the private provider and whether or not they have a process for reimbursement for consultation. The reason that we focus solely on Medicaid is because in Barron County, 75% of the youth that are accessing services are Medicaid kids. And so, and I think that's probably true if you talk to your providers in your schools and you look at their caseloads, a vast majority of the people, the individual students receiving services in your school-based setting in particular are going to be Medicaid kids anyway. So it is a very disproportionately high number of individuals accessing services are Medicaid youth. At least that's the case in Barron County. And so creating the code for them is going to help meet that need for a vast majority. And then insurance providers vary. I don't know if any of the large providers have consultation as part of their structure around here. And then maybe the most straightforward process is the DPI grant program. And so there's a new program in place this year, $3.25 million annually. It's supposed to be on a continuing funding cycle, so the hope is that there will be $3.25 million available each year, starting fiscal year 18-19, and lasting until the legislature takes it away. That program is really designed to expand school-based mental health services across the state using grant dollars to get programs up and running, with the idea that as we utilize more school-based services, we're going to see better outcomes, and it's going to become part of our standard practice in school settings. Timeline, we know the timeline on this. The language and the application and the videos and the support webinars should come out in February through DPI. So they're working through their process right now in order to create these programs. The application deadline, they told me, is March. I'm going to say it's March, April. Because March is going to come very quickly after February if they're just getting information out to districts. And we'll talk about the collaborative nature of that. And then the funding will be in place for the 18-19 school year. So applications that go in this spring will be funded for next school year. And so the money will very quickly, hopefully, come in, and we can design some programs and interventions in our schools here and access some of those dollars. Again, we worked very hard to make sure some of that money can come to rural Wisconsin, that it's not all Milwaukee, Racine, and Madison dollars. So I'm very hopeful that we can access some money through the DPI grant program this year. Yes, so DPI is facilitating the grant dollars. We went back and forth between DHS and DPI, but DPI is definitely the better place for those dollars to sit. So it'll be a school district application in collaboration with other entities, but the school district will be the one applying for those dollars. A couple of big things to point out with the DPI grant is just a lot of our work at the state level and a lot of our conversations about this grant program is on a comprehensive model for school-based mental health. And so you'll see in your packet, this is the coalition that I'm part of that has worked on the Medicaid reimbursement and this grant program. This coalition has really been the driving force behind that. This is our comprehensive model that our coalition supports in coordination with DPI. And DPI has a mental health framework, right? That is a really big book kind of laying out philosophical and areas of focus for school-based mental health services. When we talk about accessing grant dollars through this DPI program, we want to be thinking about comprehensive model for school-based mental health services. This is going to give you a very nice quick breakdown about some of the things that you should consider. One of the things that's a barrier in a lot of our schools around here is it's available to all students, regardless of ability to pay. Right now, lots of us have therapists in school buildings. That is solely based on the student and their family's ability through third payer provider to pay the bill to see that therapist. That's not a service that's open to all students. And part of this process, whatever we come up with through this process, should be available to anyone who needs the service provided to them. All right, so those are two comprehensive models worth looking at, I think, when we talk about expanded school-based mental health. So the one piece that we wanted in the language for this is that an application for these grant dollars should include collaboration with counties, hospitals, consumer advocacy groups, youth service agencies, and private entities that provide mental health services. This should not be a school trying to do it alone. I'm part of a school. None of us want to do it alone, right? But we want to partner with as many entities as possible. It's what excites me about being part of the task force is this task force and this collaborative brings together our county services, it brings together our private providers, it brings together our nonprofit providers, it brings together our schools all together in the same room. So we have already done so much groundwork in this county to look at a collaborative grant process. That's why I'm so optimistic that we will be able to access dollars through this program. All right. Again, these are some of the criteria that were laid out in the coalition legislative language. The governor line itemed several of these items to give DPI as much flexibility as possible, but our coalition is well represented on the rule writing portion of the DPI process, working through some of this stuff. And so we feel like all of these criteria will still be very relevant to the final grant application. And so it's basic things like a referral and intake process for mental health services. How many of your schools right now have a specific process that you work through to identify whether a student can access the therapist that's working in your building? Right? So how do we decide who gets those services then? So part of this grant program is going to want us to use our multi-tiered systems of support in order to, as a school, to identify who the students and needs are and what the anticipated outcomes would be for those students to access services. Right? And it's a bit of a shift when you look at that comprehensive model versus a co-located clinic model, which is what, in this part of the state, that's a lot of what we do. It's not far removed from where we're at. I think most schools around are using multi-tiered systems of support, right, to identify students in need, whether it's behaviorally or academically. So those systems are already in place, but it's trying to use those systems in order to target the interventions to those who most need them. Continuum of care. And again, Lisa's going to talk a little bit about a psychoed group process that the task force is hoping to move out into schools if you're interested in it, but a continuum of services, right? And so that we can meet students and individuals and families wherever they're at along the spectrum. It's not as easy as it looks. It would be great if we could do in-home family therapy, right? But that's not a simple process to just, let's put the program together and do it. But we want to be thinking about some of those things. And then I highlighted just on the end of that again, available to all. So it's not third-party payment based. No, I don't think it will have to include all of those things. Otherwise, every grant would be $100,000. And if you do the math, there's actually 3.25 million, 400 plus districts we're talking about. If every district applied, there'd be like $8,000 per district. That's not going to happen either. But no, we can't create a system using the money that will be available to do all of those things. And so should consider is the language that we've kind of moved to. We would like systems that consider all of these things as part of the process. And then what I can tell you is there also, from the National School-Based Mental Health Center, there really are 6 key areas that we know are outcome-based and evidence-based that we should focus on when working in school-based mental health expansion, right? And some of those areas, like screening, would make a lot more sense because it doesn't necessarily have to, it's one of the layers that we're integrating in. So more to come with the details of that. We want third-party dollars to not be left on the table, right? So one of the requirements is that whomever we're partnering with in our school settings, they need to be accessing every third-party payment that they can, right? Because if there's dollars available through Medicaid to provide those services, we should be accessing them so that the schools aren't picking up the cost, so that this grant program isn't picking up the cost, so that we bring in all the dollars that we can. Well, we know from bigger districts, though, so if you go to Madison and they have an integrated comprehensive model in a couple of their schools right now, is it's only funded through third party at like 60%. So they're 40% in the hole providing these comprehensive models for school-based services. We want to make sure we access all 60% of that to make sure those dollars don't get left on the table. And then braided funding, right? So that's the other component to this is we don't want a program that is only third party and DPI grant funded. We want a program that kind of works across the continuum throughout the community and looks for funding sources from as many places as possible. Again, that's where the task force is really well situated as a nonprofit who's working with all these entities across the community in Polk County to be another piece to that braided funding source. So. And evaluation. So again, we want to know whether this is really effective in meeting the desired outcomes. part of what I would be excited to see happen in Polk County is to identify if there's another, we went through, and many of you went through the needs assessment in the last cycle. Part of what we want this collaborative to do is to start building that needs assessment on a continuing basis. What are we seeing in our schools that we would like to try and fill the gap with? Because there's going to be third-party dollars available through DPI, because the task force is an engaged participant in that process and schools are engaged in that process, what's the need? How do we come together? Because our applications are going to be much stronger if we say, here's 6 or 8 districts in Polk County working through a task force that brings together all these providers, and this is what we want to do with those dollars. That's going to be a really strong application. It doesn't mean that you as a district cannot put together a strong application, but again, the dollars are going to stretch thin very quickly in a program like this. And so if we send down 8 separate applications from Polk County, we are a lot less likely to see funding coming back to all of our districts. Right. So any way that we can work collaboratively around this process is going to be beneficial. In Barron County, I have a meeting next Friday with the 4 superintendents who are part of my school to sit down and do exactly that. A needs assessment based on a comprehensive model, based on the evidence-based practices coming out of the National Center on School-Based Mental Health, to say what's a need that you're all sharing, and can we fill that need using third-party dollars? That would be an amazing process to work through here as well. Because again, I think it just increases the chances that we can bring in some funding.